Hello, today we're going to talk about disorders of aging and cognition. Older adults experience some of the same disorders that younger adults do, and in addition, they are at greater risk for developing cognitive disorders. Two disorders that present in older adults as well as younger adults are anxiety disorders and mood disorders. There is an increase in the prevalence of anxiety disorders among the elderly, especially generalized anxiety disorder. And older adults may have more somatic symptoms, that is, physical symptoms, of both anxiety disorders and mood disorders. And sometimes, because they may be more somatic, their disorders may get overlooked and remain undiagnosed. Also, an important concern with the elderly is how medical conditions might also produce psychological symptoms and how medication side effects may also affect an elderly person's psychological functioning as well. In the case of depression, elderly adults who do not live in nursing homes are really no more likely to be depressed than are younger adults. But if they do live in nursing homes, there is an increased risk for depression. The same treatments, both psychological and biological, that are used with younger adults have also been found to be effective in older adults. But concern needs to be there about how medication side effects might affect older adults. So, they may need different doses, and they need to be monitored very closely to make sure that they tolerate the medications well. An example of one concern about the use of medication in the elderly would be the use of benzodiazepine medication, which, as you know, is potentially habit-forming. It is used in the treatment of some anxiety disorders, as you know. And it is my understanding that benzodiazepine use is a major cause of falls in older adults because of the sedating effect it has on the person taking the medication. Schizophrenia is highly unlikely to appear the first time in an older adult. Individuals who are schizophrenic usually have their first episode, as you know, in early adulthood, possibly late adolescence, but not in late adulthood. Now, individuals who are schizophrenic deal with that disorder throughout their entire lives, but you're not likely to see it show up for the first time in an older adult. Older adults also have problems with substance use disorders. We've already talked a little bit about benzodiazepine use and how it can become habit-forming in an older adult. Other medications that might be abused in younger adults can also be abused in older adults, of course, as can alcohol. As you're probably aware, the most feared psychological problem among the elderly is Alzheimer's disease. And realistically, the risk of Alzheimer's disease does increase with age. You may know that by the time someone achieves the age of 85, there's a 50% likelihood that they will be dealing with Alzheimer's disease. As our population as a whole ages, of course, this means that going forward, we will have increasing numbers of individuals dealing with Alzheimer's disease and increasing numbers of people who are taking care of those who are dealing with Alzheimer's disease. In DSM-5, the way disorders of cognition are categorized is as either mild or major neurocognitive disorder. So you can think of these categories as being broad umbrellas under which specific types of neurocognitive disorders would be placed based on the severity of the disorder. So, for example, in the early stages, someone with Alzheimer's disease might be characterized as having mild neurocognitive disorder, and later on as having major neurocognitive disorder. Alzheimer's disease is one of several types of dementia, as you're probably aware. And we're going to explore Alzheimer's disease a little bit today. But before we get into that disease, I'd like to talk with you about another cognitive disorder that can occur in older adults, not just older adults, but they are at increased risk for it, and that is delirium. Do you know the difference between delirium and dementia? And quite possibly some of you may work or have worked in settings where you work with older adults and may have dealt with both of these conditions, both delirium and dementia in that population. But delirium is a condition that involves a state of confusion and disorientation, a disturbance in the sensorium of the individual that can last hours, really, and usually is temporary and passes, but it can have many different causes. For example, it could be caused by medication side effects. It could be caused by some sort of disease process. It could occur after someone has gone through surgery and under various other circumstances. Dementia, on the other hand, either mild or major neurocognitive disorder, is a more progressive type of disorder that's not temporary, that's not just passing, as delirium fortunately oftentimes is. And of the neurocognitive disorders, the one that we probably hear the most about is Alzheimer's disease. So let's talk about that one a little bit. In the case of Alzheimer's disease, one of the things that's really sad to consider about that disease is that there is no cure for it. And really, we're not any closer to having a cure for Alzheimer's disease today than in times past, except there is a lot of research that's being conducted in an effort to hopefully find a cure or cures for Alzheimer's disease. It tends to be a disease that affects primarily the elderly, although it can have early onset. If it does have early onset, researchers think there may be some different factors involved, including genetic factors that may be involved with an early onset type of Alzheimer's disease rather than a later onset type. But as we said, the older we become, the greater our risk for developing Alzheimer's disease. So our researchers are trying to figure out, well, how does it get started? What causes it? How can we help individuals who have this disease? And there's still a lot of unanswered questions. I have provided you with 2 videos on Alzheimer's disease. I hope you'll have a chance to watch. One of them is a researcher who talks about the status of what we know about Alzheimer's disease and research underway to try to help find a cure for it. And the other video is of a woman whose father has Alzheimer's disease and how she is preparing herself for the possibility that she may develop it herself one day. It's a very moving video. I hope you'll have a chance to take a look at both of them. One of the things that is known about Alzheimer's disease is that there are changes that occur in the brain that can be detected really after the person dies by doing an examination of their brain and looking at brain tissue under a microscope. It's my understanding that neuroimaging techniques are now allowing researchers and clinicians to possibly catch a glimpse of changes in the brain associated with Alzheimer's disease in ways that may not have been possible in the past. But the one definitive test for it, as far as I know, is actual examination of brain tissue. So as you may be aware, there are two changes that seem to take place in the brain of individuals with Alzheimer's disease. One is they form these patches outside of the neurons that are called beta amyloid plaques that are made up of a protein. And these beta amyloid plaques are toxic and cause damage to neurons and death to neurons. The other change that occurs is inside the neuron itself. And these changes are referred to as neurofibrillary tangles that form inside the neuron and also cause damage to the neuron and death to the neuron. So if someone has these processes going on in their brain, it's sort of a double whammy that contributes to the progressive decline in cognitive functioning that people with Alzheimer's disease experience. It can go on for many years before the person actually dies, with them becoming progressively worse. As you may be aware, there is an area of our brain called the hippocampus. It's in the limbic system. If you put your fingers over your ears and go in about 2 inches, that's where your hippocampus is located in both the hemispheres of your brain. And this part of our brain is very important in the processing of new experiences and creating memories that are then stored elsewhere in our brain, primarily in the cortex of our brain. The cortex, the outer layer of our brain, especially in the frontal lobe area. The kind of memories that the hippocampus is involved in storing include factual information. Say, if you know the capital of your state, that would be a fact. And also life experiences that you have. Both of these kinds of memories are processed by way of the hippocampus. Well, the memories are not actually stored in the hippocampus, but the hippocampus is vital to the temporary storage and processing of these memories that are then permanently stored elsewhere in the brain. We have neurotransmitters in our brain that are essential in helping our neurons to make new memories. And one of these neurotransmitters is acetylcholine. The hippocampus happens to have a lot of acetylcholine neurons in it. And for that reason, that part of our brain is very effective in helping us to make new memories. Acetylcholine is not the only neurotransmitter, but it's one of the important ones that's involved in the changes that occur in neurons and between neurons that make it possible for us to make new memories. If you were to talk with an older person with Alzheimer's disease, and you were to ask them what they had for breakfast, it might be hard for them to remember. But if you were to ask them to tell you about their wedding day, they could probably talk about it in vivid detail. Can you think of an explanation for why that would be so? If your thinking is that when they were young, their hippocampus worked just fine, they had all the acetylcholine they needed, they were able to make and store these memories in their brain, but now they don't have enough acetylcholine and the hippocampus just isn't working that well anymore, therefore making it harder for them to make new memories, you would be correct. So while there is no cure for Alzheimer's disease, there is medicine that people with the disease sometimes take early in the progression of the disease, primarily as I understand it, that helps to increase acetylcholine levels in the hippocampus at least somewhat, that helps to slow down the rate of progression of memory loss and help improve the memory a little bit. I suppose eventually that doesn't work either, but for a while it does. And it's interesting how these drugs work, like Cognex is one, and Aricept is another one, I believe. And as I understand it, the way these drugs work, it's similar to how antidepressant drugs work, like Prozac is working on serotonin, but now we're talking about drugs that are working on acetylcholine in the hippocampus, is that they block the reuptake of the acetylcholine so that it builds up to somewhat higher levels in the synaptic spaces and helps to enhance memory at least a bit for individuals with Alzheimer's disease. Alzheimer's disease takes a tremendous toll, not only on the person who suffers from it, but also on their caregivers. And that provides a special need and role for those who are in helping professions to not only provide assistance to the patient, but also to their family, so that families can have support. They can sometimes get a break from it. They can have assistance in looking at the full range of care and services that they may need to consider for their family member with Alzheimer's disease. And if you have ever had a loved one who suffered from Alzheimer's disease, you know what it's like to sort of see them fading away a little bit at a time, gradually over time, often over a long period of time. You realize, at least with what's known now, it's not going to get better, it's just going to get worse. So there's this grieving process that family members enter into that can be quite, involved over a period of time as their loved one is fading away a little bit by bit. And helping professionals can offer a very important service there by being able to be supportive of those who are dealing with individuals with Alzheimer's disease. I've had the opportunity to work with many older adults in the clinical phase of my professional life. I found them to be extremely rewarding to work with, and I hope that you might have that opportunity one day yourself, if you might be so inclined. I did want to just mention one, I think, very valuable service we can provide older adults in helping them to kind of come to terms with issues that may be important to them in the later part of their life. And that is to be willing to be present with them and to listen, to allow them to reminisce and reflect on their lives, to be able to appreciate their good memories and the accomplishments in their life in a way to help them to experience what Eric Erickson called integrity. And when an older person is able to look back on their life and have a sense of accomplishment about what they have done in their lives, it helps them to experience a sense of integrity. You probably have had experiences of sitting and talking with older adults and having them tell you stories about their life. Sometimes they may even repeat themselves, but oftentimes that process is one that they benefit from and we can benefit from, because we can learn from them and their experience and come to have an appreciation for their life lessons that they can teach us through that storytelling. I believe that completes what I wanted to talk with you about regarding the chapter on disorders of aging and cognition. Thank you.